in the area is extremely important and really helpful to ensure that you're treating your patients the best that you can. So pathology is another specialty, and that includes blood work interpretation as well as microscopic evaluation. So if you send off let's say you have a tumor removed from a patient, you send that off to the pathologist, they're going to look at it under the microscope and diagnose it, as well as tell you if you removed all of the affected tissue or if you left some of the tissue behind. These are also the doctors that will do most of the necropsies, at least in a university setting. Dentistry in veterinary medicine has its own specialty, which is extremely helpful. Veterinary dentists do a lot of really cool things. In addition to general dentistry, they also can do root canals, and these are the guys that if you have, especially police dogs that break canines, or really any privately owned dog, they always have the option of having a root canal if the affected tooth has healthy roots, and then you can have a crown put on. And so sometimes you can have metallic crowns. I have one dog patient that has 2 metallic crowns, which is pretty cool. There are behavior specialists, there's rehabilitation specialists. Traditional Chinese veterinary medicine has its own specialty now. Animal welfare, and this includes shelter medicine, laboratory animal medicine, microbiology, nutrition, which veterinary nutritionists, there's not a lot of them out there, but they're extremely helpful, especially if you have patients that need specific diets and you want to ensure that they're well balanced. And veterinary nutritionists work a lot with animal food companies to ensure that the food is balanced and appropriate for the pets. Theriogenology is another specialty which deals with reproduction, and that's really important in especially equine medicine. But there are theriogenologists that specialize in small animal medicine. For the most part, I believe theriogenologists practice small animal and large animal, but I do know a couple that just practice small animal reproduction. Toxicology is another specialty. If you've ever had a dog that ate something that it shouldn't and you call your veterinarian and they say you need to either call the ASPCA poison control or there's the pet poison hotline. Those hotlines are manned by generally veterinary toxicologists. So they've gone to vet school and then they've done a residency in toxicology or a specialty in toxicology, and so they are extremely well schooled in the different types of toxins, how they affect the body, and how to treat. Zoologic medicine is another specialty, and that frequently includes animals at zoos, but it also incorporates often exotic animal medicine. You also have large animal specialties as well. So there's large animal internal medicine, large animal surgery, large animal rehab. So what we just discussed is the specialists primarily under the small animal category as well as some under the large animal category. But then beyond that, you have your public health veterinarians, and those are the ones that are going to work for the CDC or the state government or the USDA or the Department of Agriculture. Something you probably don't really think about is that every slaughterhouse generally has inspections by veterinarians to ensure the welfare as well as the proper handling of the meat as it's processed. And when I was in vet school, we actually there was a slaughterhouse on Virginia Tech property, and we went and we saw how they process the meat as well as what the duties of an inspector are. You also have military veterinarians, and in general, they are enlisted and not just civilian veterinarians that work for the military, but those do exist as well. Actually, I practice near Quantico, and Quantico on base has its own veterinary service, but it's open for very short periods of time, and they will provide basic care, but then if additional, more extensive diagnostics or testing are needed, they refer to veterinarians off base. You also have laboratory animal veterinarians, and those include veterinarians that their purpose is to ensure the welfare of the laboratory animals. As far as research veterinary medicine goes, the vast majority of research veterinarians are employed by universities or veterinary schools, and as a part of their career, they teach. They generally do clinical cases as well, and then they also do research. And there are private sector research veterinarians as well. There are also veterinarians that work for drug companies, and they can work in the research setting for vaccines, for labs. They can also be a representative of the drug company, as well as for food companies, it's the same. And so any food company or drug company that we work with, there's always a local sales rep, but then helping those sales reps is generally a veterinarian who more often than not has been out in private practice for a number of years and then moved on to work for the drug company. So as you can see, there's a huge variety of professions in the veterinary field, as well as a huge variety in your ability to specialize in certain aspects of veterinary medicine. Outside of specializing or becoming a diplomat, you can also take additional training courses to become certified in specific aspects in veterinary medicine. So for instance, I have taken multiple certification courses in integrative medicine like acupuncture, Chinese herbs, chiropractic, but I am not a specialist. I have not undergone a residency program. I have just taken those multi-month, or in the case of the herbs, multi-year courses to then obtain a certificate in those programs. Part of the reason for discussing the different types of veterinary medicine and the different aspects of veterinary medicine is a lot of clients are confused when you bring your animal into your general practitioner and they say, okay, well, Fluffy has a heart murmur, Fluffy should go to the cardiologist, or Bailey has a pretty significant neurologic issue, they should go to the neurologist, or Harper has severe eye disease, we need to send Harper to an ophthalmologist. Sometimes clients are a little let down or disappointed or frustrated because they feel like, well, as the general practitioner, you should be able to treat every disease. But if you think about it, the more we learn, the harder it is for one individual to know everything about everything. And the purpose behind specialization is, one, it allows people to practice what they really want to practice, but it also is a benefit for our pets and it's a benefit for our patients, because if we send them to a specialist, they know everything about that one specific issue or that one category, and so they can provide treatment that maybe your general practitioner could not. And just like if you went to your human general practitioner and they said you need surgery, they're not going to perform the procedure, they're going to refer you to a surgeon. And that's fine, but the problem that I see in human medicine is those specialists don't communicate. They don't talk to each other. They don't look at the patient as a whole. They look at each individual problem. And so you run into issues in that the idea of the whole individual is lost. So far in veterinary medicine, we're really good at still looking at the whole patient. And that's generally the responsibility of the general practitioner. But specialists are frequently extremely helpful in communicating, hey, from my perspective, we should do this. From my perspective, we should do this. And it allows us to address the animal as a whole. I just hope we never get to the point where we have so many cooks in the kitchen that nothing actually gets done. So that's a little bit about how you become a veterinarian, the types of veterinary medicine that can be practiced, as well as why we have these specialties. And if you have any specific questions about certain types of veterinary medicine, or you want more information about how to get into vet school or what the process of going through vet school is like, just let me know. I just thought we would provide kind of an overview of information just to kind of get us started. I think that about wraps it up. As always, thank you for listening to this installment of Vetsplaining. I hope you enjoyed your time with me and ideally learned at least one new thing for the day. If you have any questions or suggestions for future topics, feel free to leave a comment below or email info@independenthillvet.com and put podcast topic or podcast comment in the subject line. Until next time.